I'm Marcella Palmer for Summit Medical Group. Summer's here. Have fun, stay fit, and be healthy. Summit Medical Group has a variety of videos and articles on their website to help you live well, stay well.
Welcome to Medical Monday with Summit Medical Group. I'm Dr. Geraldine Summa, Summit Medical Group board-certified pediatrician. Everyone spends more time outdoors during the summer months, including the bugs. Most of the time, an insect bite or sting causes temporary discomfort, and most reactions are mild. Some itching or stinging and mild swelling is common. On occasion, they may cause a serious allergic reaction or infection that requires immediate medical attention. Come on in, Mrs. Barber.
Thank you.
If your child is stung by a bee or a wasp, I want you to look to see if there's a stinger in place. Please note that a bumblebee will leave the stinger, whereas a yellow jacket or a wasp will not. If there's a stinger in the skin, get the back of a blunt knife, drag it across the skin where the stinger is. That is the most effective way of removing the stinger. If you use tweezers or use your fingers, you're going to re-inject the venom, thereby causing much more local and possible systemic symptoms.
Take a look.
Okay.
Not sure what's going on.
If your child is bitten by a spider, please note that in our northeastern area, most spiders are pretty innocuous. You'll have localized redness. I would apply a topical cortisone cream after cleaning the area with soap and water, and look for signs of infection over the next 2 to 3 days. For those of you that are travelers, the southern states have two particular spiders that are concerning, the black widow and the brown recluse spider. They will cause significant symptoms such as fever, listlessness, even life-threatening infections. I would clean the area off. I would apply a tourniquet beneath the area of the bite to reduce the spread of the venom, and bring your child to the local emergency room or call 911.
So is this where the bites were?
If your child is bitten by a tick, the first thing I'd like you to do is remove it, but remove it properly. Get a set of fine tweezers, go right to where the fangs are embedded in the skin, and yank it off. Don't use rubbing alcohol, nail polish remover, or a match. These things will cause the tick to pour in more of the bacteria and increase their risk of Lyme disease. The signs of a serious allergic reaction to a sting are systemic, their whole body. The child will develop hives, a swollen face, swollen lips and tongue. They'll have difficulty swallowing and breathing, shortness of breath, clearly life-threatening, and you need to call 911 or go to your nearest emergency room. There are two ways to prevent your child from getting bit or stung this summer. The first is avoidance, and the second is repellence. In avoidance, take into consideration not putting on scented lotions on your child, avoiding the bright colors of clothing, staying away from flower beds, and if there are any bees' hives or hornets' nets, please remove them. The second, repellents, involve chemicals. The permethrin spray is something that you can spray onto clothing and shoes. I find this to be much safer. The other is a DEET-containing spray, which can be sprayed directly on the skin. Remember, these can be neurotoxic, so at the end of the day, shower off the chemicals. This has been your Medical Monday with Summit Medical Group. Thanks for watching. Summit Medical Group is here to help you live well and stay well.